Welcome to Radiology in a Minute, where we summarize recently published research from the journal Radiology in under 3 minutes. My name is Mason Brown, I go by Tony, and I am a diagnostic radiology resident at Aurora St. Luke's Medical Center in Milwaukee, Wisconsin. Our featured manuscript is a systematic review and meta-analysis of osteoporotic compression fracture mortality outcomes following vertebral augmentation. The purpose of this study was to evaluate and compare mortality outcomes of patients with osteoporotic vertebral compression fractures, either treated with vertebral augmentation, which encompasses both vertebroplasty and kyphoplasty, or non-surgical management, which includes bed rest, pain medication, muscle relaxants, back braces, and physical therapy. After statistical analysis of more than 2 million patients with osteoporotic vertebral compression fractures, Hindi et al. Concluded that vertebral augmentation reduces mortality by 22% up to 10 years post-treatment compared to non-surgical management. Vertebral body fractures are the most common complication of osteoporosis. These types of fractures can lead to impaired mobility, which can indirectly cause deconditioning and pressure ulcers, as well as gastrointestinal side effects from pain medications. Vertebroplasty and kyphoplasty are both minimally invasive surgical procedures that utilize a special type of cement to reinforce the compressed vertebral body. Kyphoplasty additionally involves the use of an inflated balloon prior to cement reinforcement in order to restore vertebral body height. Radiologically, both vertebroplasty and kyphoplasty will appear the same on imaging. Therefore, vertebral augmentation may be a more accurate term to use in radiology reports. By design, this meta-analysis incorporates multiple independent studies on the management of osteoporotic compression fractures. A key statistic that the authors prioritize is the hazard ratio, which is a ratio that depicts a given negative outcome over a function of time. Essentially, for this study, any value greater than 1 favors a non-surgical management, and any value less than 1 favors vertebral augmentation. Such statistics are attained using regression analysis via a statistical software program. For those interested in learning and or performing their own statistics, links to these software programs are provided in the video description. The pooled hazard ratios across 7 studies, denoted individually in red, included approximately 380,000 patients who underwent intervention and 1.7 million patients who were managed conservatively. The cumulative hazard ratio of these studies was 0.78, denoted in black. This data suggests a mortality benefit of vertebral augmentation following osteoporotic fracture. While both vertebral augmentation procedures offered a mortality benefit, kyphoplasty was slightly more beneficial. A link to the full manuscript is provided within the video description. Thank you for tuning in, and we hope the presentation and resources provided help you in your continued medical education.